at square one. What is lupus? Lupus is a chronic disease. Because lupus is an autoimmune disease, the body's immune system becomes hyperactive and attacks healthy, normal tissue. Usually the immune system guards the body against bacteria and viruses by producing antibodies. When it detects foreign invaders, it dispatches fighter cells to attack these invaders. Now, when a person has an autoimmune condition such as lupus, the immune system cannot distinguish between the good guys and the bad guys, which are antigens. When the immune system malfunctions, it mistakenly attacks the healthy tissues, the organs, and the cells. This causes swelling, pain, and tissue damage. According to the National Association of Chronic Disease Directors, approximately 1.5 million Americans have a form of lupus. Lupus can cause inflammation and pain in various parts of the body. Lupus commonly affects your skin, joints, and internal organs such as your brain, heart, and kidneys. Follow me for more tips, facts, and much more. So there are 4 kinds of lupus. The first kind is drug-induced lupus, and that's caused by certain medications. Symptoms usually resolve within months of stopping the medication. The second kind is a cutaneous lupus. That affects the skin and is triggered by sunlight. And there's 3 types of cutaneous lupus. The first kind is acute cutaneous lupus. The second kind is subacute cutaneous lupus, which is SCLE. Then the third kind is discoid lupus, which is DLE. The third kind is systemic lupus erythematosus. This is the most common and severe type of lupus. It is widespread inflammation and tissue damage in the affected organs. That's the kind that I have. Then the fourth one is neonatal lupus. This is when the infant has SLE symptoms from the mother. And they also have a rash. The infant can occasionally have systemic abnormalities, such as a complete heart block. So these are the type of lupus. There are 4 types, once again. Follow me for much more tips, facts, and much, much more. What are the signs and symptoms of lupus? So there's a wide range because it affects different organs. Lupus symptoms differ from person to person, so some may have a few mild symptoms while others have severe symptoms. Most people with lupus have flare-ups or flares. This is when the signs and symptoms get worse for a while and then improve or disappear completely for a period of time. So flares can go from days to weeks to months to even to years. The most common signs and symptoms are fatigue, sores or ulcers in the nose or mouth, joint pain, stiffness and swelling, butterfly rash, which is on the cheeks and nose, sensitivity to sunlight, fingers and toes that turn white or blue due to stress or cold, chest pain, shortness of breath, hair loss, headaches, brain fog, and memory loss. Lupus is also called the great imitator because it mimics other illnesses such as rheumatoid arthritis, diabetes, fibromyalgia, and many other diseases. Follow me for much more facts, tips, and much, much more. The diagnosis of lupus. So diagnosing lupus is difficult because signs and symptoms vary from person to person, as well as signs and symptoms do change over time. One test alone cannot diagnose you with lupus. The combination of blood in your intestine, signs and symptoms, and physical examination results lead to diagnosis. So the first section would be lab testing. So that's blood and urine. So you have the complete blood count, erythrocyte sedimentation rate, kidney and liver assessment, urinalysis, and the ANA testing. So that stands for anti-nuclear antibodies. Then you have imaging testing. So that's the chest x-ray and the echocardiogram. Then you have the biopsy. So the kidney and the skin are the 2 common spots where biopsies happen. So with the skin, they take a piece of it and they send it over to check on the inflammation as well as the tissue damage that's happening to the skin. Then with the kidney, there's 2 ways. You can do it with a small needle, or they will make a small incision to take a biopsy of the kidney to see what's going on, if it's affecting the kidneys. So that is basically the main testing that is done. Follow me for more facts, tips, and much, much more, because I do have a more detailed version on my blog. So check that out. and I'll talk to you guys later. Risk factors for lupus. Who's at the highest risk of developing lupus? So the first factor would be your gender. Even though anyone can get lupus, it affects most women. They're 9 to 10 times more likely to develop lupus than men. Second one would be your age. Lupus can occur at any age, but most are diagnosed between the ages of 15 to 44. Third would be your race. Lupus is 2 to 3 times more common in African American women than in Caucasian women. It's also more common in Hispanic, Asian, and Native American women. African American and Hispanic women are more likely to have severe forms of lupus. The fourth factor would be family history. Relatives of people with lupus have a greater chance of developing lupus. These are the risk factors for lupus. Follow me for more facts, tips, and much more. What are the common triggers for lupus? So triggers are things that can bring us into a flare. So the list as goes: overworking yourself, not getting enough sleep, stress, whether that is physical, mental, or emotional, an infection or a cold, sunlight, injury, or stopping your lupus medications. Even though you are on lupus medications, you can still trigger a flare. For example, you can get a flare if you've been out in the sun all day or you had a vigorous day at work, even if you're on lupus meds. So, something I'm always told by my doctor is try to get at least 8 hours of sleep. I think they said probably get like 9 to 10, but try to get a minimum 8 hours of sleep. Sunlight, when you're outside and there's sun out, even if there's not sun out, always wear your sunscreen, whether that's the spray or the lotion. Physical stress, not trying to overwork yourself, whether you're at work, at the gym, exercising. Moderation is always good. Stressing, like emotional stress and mental stress, that's things that it's hard because it's life, you know? But when things are on your mind, try journaling, try writing things out, try talking to yourself, just to tell yourself it's not worth, overstressing yourself into a flare, because that's very easy. But these are the triggers. Follow me for more facts, tips, and much, much more. Treatment for lupus. So there's no cure for lupus yet, but there are treatments and medications that are used to improve quality of life through limiting symptoms and decreasing flares. This begins with lifestyle alterations such as diet and exercise. So the first type of treatment is non-steroidal anti-inflammatory drugs, also called NSAIDs. This can be used to treat pain, swelling, and fever associated with lupus. The most common type of drugs would be Aleve and ibuprofen. Second kind is anti-malarial drugs. These meds are used to treat malaria. The most common type is Plaquenil, and that helps reduce the risk of flares. Third type is corticosteroids. Prednisone and other type of corticosteroids are used to counter inflammation. The fourth kind is immunosuppressants. These drugs are used to reduce the strength of the body's immune system. Fifth kind is biologics, and that's given intravenously. This is a solution for those who have issues taking medications or haven't found any relief by taking medications. So these are the type of treatments that are used to treat lupus. Follow me for more facts, tips, and much more.